The COVID Cabinet Committee today approved a requirement that all 25,000 employees of the Alberta Public Service show proof of vaccination or a negative regular test results. The majority of employees within the broader Alberta public sector, including Alberta Health Services, post-secondary educational institutions, and government agencies, boards, and commissions have already adopted similar policies. Public Service Commissioner Tim Grant will provide more details about this decision in a few minutes, but the message is clear. We value our public servants and the important work that they do. That's why we want to ensure that they are operating in safe workplaces and that we are doing everything we can to protect the millions of Albertans to whom they provide services. That's also why the Ministers of Health and Education will be writing to school boards across Alberta in the days to come to ask that they consider adopting similar policies for their employees, including Alberta teachers.
As the Premier noted, the Government of Alberta is implementing a proof of COVID-19 vaccination policy for all Alberta public servants. Vaccines are proven to be a safe and effective way of limiting the spread of infection and preventing serious health outcomes. This is why we're implementing a proof of vaccination or ongoing negative test requirement for all Alberta Public Service employees. Unvaccinated employees will have from now until November the 30th, 2021, to become fully vaccinated. To achieve this, unvaccinated staff should receive their first dose by October the 31st, 2021, and their second dose by November the 30th. By November the 30th, all employees should submit proof of full vaccination. Employees who are not vaccinated will need to produce a negative PCR or rapid test result within 72 hours of every scheduled workday or shift on an ongoing basis. These tests will be required and will be paid for by the employees. Employees who are unable to be vaccinated, for example, due to a medical condition, will be required to obtain an accommodation based on the Alberta Human Rights Act. We've seen that several public and private sector employers within and outside the province have implemented similar vaccine policies for their employees. I will add that the restrictions exemption program will be implemented in Government of Alberta facilities such as the Jubilee Auditoria, museums, and some historic sites. This is consistent with other Alberta venues so that Albertans can continue to support local artists and business in a safe manner.
Our hospitals continue to experience unprecedented pressure, and our ICUs in particular remain under immense strain. You've heard already that we have currently 307 patients in ICU with a total ICU capacity of 372 ICU beds open in Alberta, including 200 additional spaces. We have opened 23 additional ICU surge spaces in the past 7 days. Provincially, our ICU capacity, including the surge beds, is at 83%. Without the additional surge spaces, provincial ICU capacity would be at 179%. We continue to see more patients needing critical care. For example, yesterday, we had 27 patients with COVID who needed to be admitted to the ICU, one of the highest number of daily admissions this month.
I hope that over 90% of people in the Alberta Public Service are already vaccinated. So at the end of the day, this policy may only help increase vaccine rates by a few thousand, but every bit matters. We are asking the private sector to do the same thing. We need to lead by example as well. If we all continue to do that, I believe we can have continued momentum on the vaccine rates. And I'm now confident that we'll get over 85%. If we can get up into the high 90s of first dose coverage and the vast majority of those people coming forward for their second dose, we will be in a much better position to deal with the cold months to come. And that will be very welcome relief for our highly stressed healthcare workers.